Munir, a lecturer in molecular virology from Lancaster University. Welcome back to the programme. The pandemic obviously looks different in different parts of the world, but how concerning is this rise in UK COVID-19 new cases and hospitalisation? How worried should we be?
I think there is a relatively little worry at the global scale, but there are individual cohorts that are a high vulnerability. For instance, people who have chosen not to be vaccinated, people who are passing through a certain age threshold, 60 plus particularly, and people with immunocompromised status. So those people are really the ones that are more vulnerable on a sheer number of cases when we see at a country level. And I think this time is slightly different, because our only benchmark of assessing the severity of the disease is hospitalization, because the people are not being tested at a population scale. And that is worrying in some way, because people who ended up in hospital, if that is the benchmark to see the severity of the disease, that is too little and too late, because at that time we can't really do anything. So therefore the testing must be done at the community level, where we know the situation of the disease before they end up in the hospital.
I think last time we were on, you were on the programme, we were in the middle of the pandemic and everyone was wearing masks and social distancing was the order of the day and a ban on public gatherings. I mean, are we approaching the possibility of having to look again at the reintroduction of masks and social distancing and so on?
So that's a very important point, Jamie, because over the last 2.5 years, I think learned enough, and we do understand that the masks provide best economical, non-pharmaceutical intervention to block the transmission of the infection. And this is not a restriction. Wearing a mask is not a restriction, it's a protection, it's a control measure. So therefore, I think it is more important at this moment, when the number of cases are increasing significantly, and we are at the time when there are large events are to be planned, for example, Somerset or in Edinburgh Musical Festival, all these gatherings are really the breeding sources for this virus to transmit. So having mask in the pocket, having mask into the cars, and wearing it at the time when you go into gathering, you go into indoor setting is really advisable.
And what about vaccines? Are we going to be seeing a vaccine campaign this autumn?
Certainly, we have to ramp up with the vaccines, because that is the only way we can immunize the population on a larger scale. We do understand there are complexities with the vaccine, particularly with the waning immunity, but the next booster, I mean, it needs to be expanded beyond 50 years and lower age group in the UK, and have to amplify it, because people have already started waning the immunity, and that immunity is not boosted. That means that the number of cases would increase more than what we are currently seeing.
Do you sense that there is public support for a continuation of the vaccination campaign and other restrictions, or do you sense that we're beyond now and the public has moved beyond this?
No, certainly, I think we all appreciate that the overall situation and overall the message from the government is such that the public is very much complacent. There is no COVID according to their calculation or the way they are being communicated the message. But literally, we are still passing through the pandemic. We haven't been through yet to this pandemic, and the possibility for this virus to come up with new variants is very likely. I mean, on an average, since the start of this pandemic, we are having a new variant every 3 months, and it's no mean we are done with this one. And if we are even done it, virus hasn't done with us, and there is no saturation level for this virus to mutate more and more, and it will carry on mutating until it's reached to a point where we have literally no fuel left for the virus to fuel on.
Mohammed Munir from Lancaster University, thank you very much indeed for talking to us.
Thanks for having me.